Thank you, Dan, for joining us. First of all, could you remind us very quickly which are the five recommendations made by WATHI to improve the functioning of health systems in West Africa?
Yes, thank you, Imo, for the question. So the five recommendations made by WATI to improve the functioning of health systems in West Africa, in the document that we call Mataki, that was published last year in early 2020, are the following. The first one is to put in place a preventive policy to combat diseases at the heart of the health system. The second one is to ensure the training of sufficient human resources for health, including mental health, their equitable distribution of human resources also throughout the national territories, and their effective supervision. The third one is about better financing the health systems in order to promote access to care and medicines. The fourth recommendation is to improve the day-to-day functioning of health sectors, service delivery institution. Basically, it's just to improve the functioning of our health structures. And last one is more about strengthening national health systems through the development of research, the pooling of resources at the national, at the regional level, and the institutionalization of public debate on national health policies.
All right. Well, today we'll be focusing on the first one. Tell us more about it.
Yes, the first recommendation is about the prevention. As I was mentioning, it's about putting in place a preventive policy to combat diseases at the heart of the health systems. Indeed, we understand that prevention is very important. It's the key to a good health systems or a good national health policy. Before we get, it's important when we talk about having a budget for health systems. It's not just about treatment. It's also important to have in mind that we need also to invest in prevention, because when we have populations that are well aware and well informed of what is at stake and how to avoid some diseases, how to prevent from how diseases, then depression and the impact of diseases is less, and then you spend less money to treat the population, to treat the people. There are a series of sub-recommendations under this first recommendation. The first one is to include prevention, primary health care, and the basic principles of mental health in the training of all health professionals. So it's important for the health professionals to understand that also, to understand everything at stake around mental health. We also talk about including prevention of illnesses, domestic accident and traffic accidents in the school curriculum from nursery to end of secondary school, and ensure that all teachers are trained in the field beforehand. Children at school must understand how they can avoid domestic accidents, traffic accidents when they get older. It's important for them, like some illnesses like malaria, how they can prevent malaria. All this is important. And then we are talking about preparing brief explanatory document in words and pictures for parents who are the first educated and distributed those documents in prevention and healthcare centers. When we talk about raising awareness of children, who can raise awareness of children? It very first one are the parents, at home. It's important to have well-aware parents that can, pass the right messages to their children. We are talking about here creating or consolidating a network of information centers on prevention and well-being located as far as possible in all municipalities and rural communities, so that we can have well-aware citizens.
Now, finally, Dan, WATHI already organized a virtual meeting on this first recommendation, gathering several experts across the region. What was the outcome?
Yes, so on March 2nd, 2021, the first, virtual meeting on health systems organized by WATI was specifically about prevention. We gathered 4 different health experts across the region in 4 different countries also of West Africa. The first one was the executive director of Go Medical in Benin, Doria Ray. She runs the e-health company. The second one, Efrazi Koulibaly Kambou, is the president of the Ivory Coast association, well-being association in Ivory Coast. The third one was Marie-Hortense Koudika, that is working at Sans Frontières, Doctors Without Borders in the regional office in Dakar. And the third one was the Dr. Professor Akouri Ak-Ignan, that is the director of National Health Institute in Mali and the coordinator of the COVID response of Mali. So the main outcomes of that virtual meeting, that discussion that we had around the prevention and how to get efficient preventive policies in West Africa, there were several very strong points that were discussed, but I will just talk about maybe 3 or 4 main outcomes, main recommendations of that that came out of that virtual meeting. So the first one was that the population has to be at the heart of any public health policy in West Africa, meaning that before the elaboration of the public health policies in West Africa, in countries, populations, communities has to be consulted first to see where are the gaps. What is necessary? What do they need? What does exist and what doesn't exist? What is the situation? And have that community consultation can only be positive in a sense that you can then, when you have that national consultation, you will see the main concerns of the population and also the recommendations of the populations at each community. What do they need? So it's important. Then the second one was that, as we mentioned, it's very important. It's really critical to sensitize, to raise awareness of children since the very young age to prevention in order to reach a concrete behavior change that will be measurable in each community. It's important that parents and teachers be aware of all the important information on prevention so that they can transmit those messages to the children either at home and at school. And then the another recommendations was that it was important to also be very careful on the way the messages are being elaborated. The messages has to be elaborated by the health professionals. This is a fact. But then on the way to transmit messages, we know that sometimes the health professionals can use very technical terms that will not be understood by the audience, by a very common audience, by the general population. So it's important to once they elaborated those messages, to, as we were saying, to see which are the right tools for national health policy or national health strategy. It's not just about equipment, it's not just about treatment, it's also about prevention. Prevention is the first step to a very healthy population.
Indeed, Dan, thank you so much for talking to us.
Thank you.